So the reason I highlighted the metric unit conversion where it says kilograms to grams, I don't anticipate that you would ever be doing a kilogram to gram conversion. You might do grams to milligrams, grams to micrograms, micrograms to milligrams, micrograms to grams. But I don't anticipate that you're going to be doing any kind of kilograms to grams because that's doesn't, I haven't seen that question type. However, you will do pounds to kilograms. That's a common thing, especially with the what's considered the complex dosage calculation problems, where you're going to calculate a medication based off of weight. And then some flow rate questions. Flow rate meaning, calculating milliliters per hour or even calculating a drop rate, which is drops per minute. And everything else you've seen. But again, if you need a review on anything in these other categories, let me know. I'm happy to, review any of these things. Like if you need a refresher on your intake question, if you need a review on reconstitution, just let me know. But I think most of the Boyce students have been doing really well with those types of questions. Okay. Remember, you got to know your conversions, so that hasn't changed. You still got to know your conversions. I crossed out a few things on here just because I don't think that it's necessary that you necessarily have that memorized. But it's there. You might get a where you have to convert centimeters to just want to see here. Yeah, we have to convert centimeters to inches. So I think we said that 1 inch equals 2.5 centimeters, and then that way you have that. And I'll just add that there so that way you have it listed. So the ones that I worked through, I already did the flow rate type question. So what I'll do is I'll do the second one that's listed here since it's new. And I'm just going to kind of go in order this time. If you were here on Tuesday, I did flow rates first and then yes. Yeah. So yeah, today to my understanding, you guys are taking the 120, 130 test. If I'm wrong, I have other material, but to my understanding, you're taking the 130 test, so we would just be going over what to expect for the 130 dosage calc exam. So like I said, if you feel pretty good about the material in the 130 review, like you looked at the blueprint, you have a good understanding of all these things, then you're good to go. You don't have to stay if you don't want to, but if you have questions, that's what I want to try and answer for you. And then just to go over some of the highlight things that I think might show up and give you some trouble if you're not 100% confident on it. So what I did is I went through and I put together some questions, just copy pasted questions that fell into these categories. If you get hung up on this primary and secondary are just like your piggybacks or something like that. And all that really means is what would be the flow rate for that secondary thing added to the already active flow rate that's going on. Usually you're doing a calculation based off of the individual bag, not trying to like combine the information. Just if you've ever wondered about that. I've had that question maybe once. Most people seem to understand that. So I'm going to go through because this was a question that was asked even in the 240 review, was just to review like the drop rates. Now, have you guys had drop rate and flow rate already? Do you guys already know that, or is this new to you?
We have, but
We went over it briefly in like 110, but it wasn't an actual lesson.
Okay.
So this is for me, this is new.
Okay. Thank you for the clarification. For Allegheny students, 110, we don't necessarily cover flow rate unless it's just like touching on it just to say like to be prepared for it. So that's why I wasn't sure where some of you were at. So thank you for the clarification. So, and then, well, yeah, no, that's fine. We'll just stick with this and then I'll work my way down. So I start with the hard stuff first, where this is kind of new. So you'll see that I wrote, and I'm going to write it again. In order to calculate a drop rate, you need two pieces of information. You need to know the flow rate, and you need to know the drop rate or drop factor. Those two pieces of information will give you your drop rate. When we say flow rate, we're talking about volume over time. And typically you're going to see that represented as milliliters per hour. Sometimes you'll see it written as milliliters per minute. If you are being asked, and I'll give an example, like when we get down to the Ringer's lactate question, when we are asked to calculate a flow rate, you're going to be looking for milliliters per hour. Drop factor is given to you. So it'll tell you the drop factor is 10. It'll show you a picture of a drop factor. It'll say that you're using microtubing. Microtubing, you need to know that that means it's 60 drops per milliliter. So drop factor is always going to be in drops per milliliter. And then your drop rate, when you're calculating that and you give your final answer, it should be in drops per minute. So let's work through this question. You can see that I worked through this. So if you didn't see these on Tuesday, just know that I've already, you can go back and watch that video and see that I worked through them. You can pause it so you can try it out yourself if you haven't tried it out already. And then we'll go from there. So in this example, when I'm looking at flow rate, so there's a lot of information here. There's the medication, how much medication, the volume, time, another time, and then the drop factor. And then it even just says, what is the flow rate? And that can even be a little bit confusing as to what you're looking for. But if they give you drop factor, what they're looking for is the drop rate. Okay. So let's solve this by using the data that's here. So I'm going to take my volume and I'm going to take my time. I'm going to take my drop factor. And then I'm going to solve. So what I do is this ended up being a little bit simplistic. So 75 divided by 25 is 3 times 10, and you get 30 drops per minute. Now, if you're somebody who really likes to do ordered over available, desired over have, or whatever you call it, these don't work as well. You can do it as long as you are paying attention to what goes where. But that's why I usually try and get you to focus on the formula flow rate times drop factor. And that at least lets you know where things should be, even if you just leave it as, 75, 75 over 25 times 10, however you're setting that up. But just remember, if you're doing ordered over have or desired over have or order available, whatever it is, just know that it may not work exactly the way you want it to with flow rates. So you just got to practice it, make sure you have it down. But you'll notice that I did not include the 45 milligrams. And the reason I didn't include the 45 milligrams is because that just tells me the medication that's being added to via the IV. So that's important from a clinical standpoint, what the patient is receiving, that they're receiving an antibiotic and not a, anticonvulsant or whatever else might be administered via IV. But when it comes to what it is, when we're asking you to calculate a rate, we really don't care about the vehicle doesn't change the rate. So I always use the example, like if you're driving a Tesla and I'm driving a minivan, then we're not, it doesn't really matter what we're driving. We're both going 45 miles per hour. And that's what I'm asking you. How fast are you going? 45. Okay. So there's no variance in that as far as what that does. Then the every 8 hours is just telling you kind of how often you're administering this antibiotic via IV. So you're going to give them 75 milliliters in 25 minutes, and then they're not going to receive anything. And then 8 hours later, you're going to repeat the procedure. So basically, they're getting gentamicin 3 times a day, but it's just coming via IV solution. And then, so, and those are why I'm canceling those out. So someone asked, are we finding the drop rate or the flow rate? So technically, drop rate is a type of flow rate. So if they give you the drop factor, they're looking for you to give the drop rate. If you're unsure or if the question's unclear and you're just not 100% certain on to what your instructor is asking, I would tell you to calculate both. And so I'll show you both. But if there's a drop factor there and it's 75 milliliters and it's a medication in 25 minutes, they're asking for the drop rate. But I'll show you how to calculate flow rate as well with this. So my answer for this would just be the 30 drops per minute. If I were just calculating the flow rate, milliliters per hour, I would just take my 75 milliliters, 25 minutes, and then I would convert minutes to hours. So if I'm doing, like I said, a standard just flow rate, then that's what I would do. So again, 3 times 60 would give you 180 mil per hour.
Okay, I'm confused because I thought we were already, because this is what is the flow rate. I thought that's what the 30 drops per minute was, right?
Correct. Someone else asked in the chat, are we calculating flow rate or drop rate? And then that's what I was clarifying, that drop rate is a type of flow rate. And so if I'm answering this question, and because I've seen this question a number of times, and typically the question is asked, what is the flow rate in drops per minute? But because your Boyce, they don't give you the units at the end. So I know that this is a drop rate question, but they asked, how do we know if it's flow rate milliliters per hour or is it drop rate drops per minute? The way I know is because it gives you the drop factor. But if you want to be on the safe side, you technically could give them both answers. But from my experience, the one answer would just be the drops, the 30 drops per minute. Let's look at just a flow rate question. So this question is just a flow rate question because it says patients receive 400 milliliters of Ringer's lactate over 5 hours. What would you set the rate on the infusion pump to? And then it even tells you in milliliters per hour. Sometimes it won't tell you that. But notice they'll say, what is the infusion rate? That's the same thing as flow rate. Sometimes they'll say drip rate, and it's still asking for milliliters per hour. You'll see that next semester when you do your heparin infusions, because heparin is so slow. It's like, 30 milliliters an hour. It's so slow. It is at a drip. It's just that it's not considered a drip rate because there's no drop factor listed. Just so you know, I don't make the rules. I'm just following what the examples are. So believe it or not, this is actually a commonly missed question because you're looking for more to do. But all you're going to do is take the volume over the time and then reduce it. So 400 divided by 5. And you're going to get 80 milliliters per hour. So even that's coming out relatively slow, right? So if you think about what is 80 milliliters, 80 milliliters is a little more than 2 ounces, with an ounce is 30 milliliters, and 2 ounces is nothing. It's a small amount. It's a sip of juice or sip of coffee, and when you have that little amount that's coming out, like over an hour, it's going to look like it's dripping in there. But don't confuse it with calculating a drop rate. And the only way I can count a drop rate is if I have a drop factor. If I don't have a drop factor, can't calculate drop rate. Let's look at some other flow rate questions. Here's another one. Go ahead and try this, the 200 milliliters over 1.5 hours, and type your answer into the chat. If you don't want to like publicly say it, just send it as a direct message, and then I'll give you the answer. I just want to make sure you guys can do it, which I know you can, but
Where did you get 80 in the last example?
400 divided by 5.
Okay.
Good question. So I'll leave that up just so you can see it. All right, so everyone's getting consistent answers. So now with your rounding rules, this is one of those weird ones that it probably wouldn't work out this way, but your answer should actually be 133.3 milliliters per hour. In reality, you may not be able to set it to a decimal, but you can give someone a decimal milliliter. So you can give them a tenth, a hundredth, a thousandth, a millionth of a milliliter. That is a possible thing. So from what I understand, you would want to write your answer down to the nearest tenth, because that's what they tell you to do in the blueprint. So 133.3 milliliters per hour would be the most exact answer. You might want to get some clarification on that, obviously, because you're the one taking the test. Meaning ask your instructor to say, hey, just want to make sure, like, if I get an answer, you can even give them this as scenario. If I have 200 milliliters over 1.5 hours and I get an answer of 133.3 milliliters per hour, do you want it as a whole number or do you want it to the decimal? Let me give you another drop rate question for practice. Let's see if I can find one. Give me 1 second. I'm going to pull up one that's a little bit new for you. Because this will be good practice. I think most people are pretty solid on the flow rate questions. It's the drop rate questions that are can add you a little extra challenge. Wait 1 second. This might work. Sorry, I opened up the wrong folder. You can't see what I'm doing, but I am trying to find something for you. I just looked at some new ones this morning with the 240, so. Okay, yep, you got it. Yeah, we can do a reconstitution, absolutely. Yeah, everything is gentamicin. I wanted to see something that was a non-gentamicin question, just so you can see what it looks like differently. And then we'll go to the other version. There we go. So I'm going to add a few questions here just so we have it. So just give me a sec. Oh, wrong. Don't need that. So these are some additional questions. I'm going to do 2, and then we'll do a reconstitution. If you're ever looking for additional practice questions, just I have a few in my in the other campus folders. So if you're on the OneDrive folder, you're welcome to look around at the other things that I have. Okay, so we'll go ahead and use these things here. So we have, in this example, we have an IV, 500 milliliters, dextrose, 5% water. It's infusing at 210 milliliters per hour. Drop factor is 10. And then it says, what is the drop rate? So go ahead and take a moment and see if you can answer that one. And then I'll tell you to go ahead and do the second one as well. Try them both, and then put your answer into the chat, and then I'll confirm your answer. And then if there's anyone that wasn't sure where I got the answer from, I'll help out with that. So I'm seeing some of the answers come in for the first question here. And then I'm seeing a couple different answers that I want to see if we can get some clarification on. So, oh, actually, I did. I gave a clap and did not mean to do that. Let me remove that away. So there's a couple of people that are getting a variety of answers that are not the right one. So let's go ahead and work through this so you can see what to do. So this is one of those where I intentionally, the way this was written has some extra information. It's telling you that there's a 500 milliliter bag of dextrose 5% water, and then it tells you the flow rate. So remember, when you're calculating a drop factor or drop rate, you need flow rate and drop rate. So I don't care what the total volume is. That just it's important to know because so we know when to like change it, but it's not important to know for calculating the drop rate. So what I'm going to do is I'm going to take my 210 milliliters, and then I'm going to simplify this. So instead of worrying about doing an extra step, like an extra dimensional analysis step, I know that 1 hour is 60 minutes. You know that 1 hour is 60 minutes. Times my drop factor And when this is all said and done, you'll get an answer of 35 drops per minute. So if you got some real big number, it's because you forgot to divide by 60. And then other numbers, I'm not sure where those came from. You may have introduced the 500, but now you know not to do that. So 210 times 10 divided by 60, and you get 35. For the second one, you should have gotten 75 drops per minute. Now this one's very similar to the gentamicin question. So it tells you Solu-Medrol 200 milligrams IV. That's great. We know what medication they're on, but it doesn't help us out with flow rate, right? So when I'm calculating a drop rate, I need to know two pieces of information: flow rate and drop factor. The flow rate tells me you have a 250 milliliter bag and then 50 minutes. So 250 ml over 50 minutes times 15. And you get 75. So we'll say the big thing is practice, practice, practice. There's a lot of flow rate questions, though a lot that I've already worked through. And what I would say is there's like a blank version of this. If you need it blank, just email me and I'll create one and I'll turn it into a PDF. That way I don't edit it. Go ahead, Jasmine.
So is when we write GTT/minutes, is that part of the answer? Like
Those
on
are
the
your
focus
units.
count, like we have to write /minutes.
Yeah, you have to write your units. Yep.
Okay.
Good question. Yeah, they're going to expect you. So like, just like last semester, you had to write ML or tablets or capsules. You have to indicate your units. If you just tell them 75, they're going to say 75 what, and then mark it wrong. So 75 drops per minute. Now, sometimes like at Allegheny campus, we give them what they're looking for. But your question is going to look more like this, like what is the flow rate or what is the drop rate? What is the infusion rate? And then you have to know what units to put that in there. So that's why I was trying to tell you, if they give you a drop factor, they're looking for drop rate. If they don't, then they're just looking for flow rate. All right. Let's jump down to a reconstitution question, since that was also asked, just as a refresher. I have one down here. All right. So and I'll just revisit this. So first of all, a couple things to remember when you are wondering if you're even dealing with a reconstitution question. The first thing that will be like a trick or kind of a clue is that it'll tell you that you're looking for something intramuscular. So intramuscular means it's an injectable, which means your answer is going to be in milliliters. So even if it doesn't tell you like what to do, but you can even say that in this question, it tells you, and it's not here, but it tells you to shade the syringe. Okay. So if it's a syringe, you know it's not a tablet or a capsule. Yeah, I'm not going to remember to email you, but you can email me and I will take care of that. Now I won't be able to get it done until probably tomorrow, just so you know, just to give you a heads up. But if you email me, and I'll give you my email at the end of the review. So if we're doing this question here, before you look at anything else, you know that if it's intramuscular or subcutaneous or IV, that it's an ml is your unit that you're going to be administering. Okay. So that way you know what unit you're looking for at the end. And like I said, the other thing is the fact that it says there's a syringe potentially, then you'll know that. So then you look at your label. Now, in a typical like parenteral medication, like you've had like last semester, you probably saw like a heparin question or a dilantin question, where it tells you like 250 milligrams per milliliter. It tells you right on the label what the concentration is. A reconstitution doesn't tell you that right on the label. It'll say the whole quantity, 1 gram. And you can't make any assumptions on that 1 gram. Like, what does that mean? Like, how many like, is it 1 gram per milliliter? You can't make that assumption. So when you're dealing with a reconstitution, what that really just means is you have to look in the label area to find the information you need to solve this problem. And what you're looking for is this right here, where it tells you the 330 milligrams per milliliter. And then you just solve it like you've done before. So a lot of you like to do the dimensional or the ordered over available. So 375 over 330 times 1 ml, and then you get your answer. So the trick to this, and the trick to any kind of reconstitution question, is just looking for the concentration of that particular reconstitution. So you don't need to worry about, adding water and doing anything like that. The label tells you. It's required by law that the label tells you the strengths. That way there's less or no error. But you might have to, there's the occasion that you might have to do like a calculation. Like in reality, like when we talk about like, the math part of things versus the everything else. If this is 1 gram and you add 3 milliliters total, you're actually going to get 333.3333333 milligrams per milliliter. And they just round it down to 330. So just kind of to put things in the context. And if you didn't follow what I just said, just ignore it, because you don't need to necessarily worry about that. But that's what you're looking for with a reconstitution. And you can do like an image search for reconstitution labels, and then you can look at the different variations. I gave 2 examples here. So I gave you the Kefzal example, and this is the Ansef example. Again, it'll just say 500 milligrams. It won't tell you right off the bat, the big label, what the concentration is. That's why you have to look into the label itself. So that's how you do these reconstitution questions. And I'm just going to double check so if you have any questions, or if you have something else you want to see work through, just type it into the chat. Okay, good. Yeah, I'm glad that helped. So good. I'm just going to double check, because I may already have a blank review available for you. I might. I'm double checking here. Okay, no, I don't. So I'll create one, and then I'll upload it to the folder, but just email me to remind me. And I'm going to put my email in the chat so everyone has it. So if you need, if you want a blank version of what I've written on, let me know. And what I'll do is I'll save it as a PDF. I just need the reminder, because then I'm going right into another section, and then I'll forget. So that's why I'm telling you. And I'll probably just do it with this one with the new things I added. The other thing I wrote up here is the 2-step question. So what I'll do is, let me just give you a new 2-step question that's similar. Let's write it up here. And what I'll do is I'll change the variations on this. So let's make this 2.5 milligrams. We'll say the child weighs 68 pounds, and then we'll do 35 per 2 ml. So when you do this, what are considered 2-step questions, these are just weight-based questions. So what they're saying is you want to account for the patient's weight when you are making your calculation, and the the key to that, or the clue to that, is it'll tell you milligram per kilogram. So as opposed to just saying like, 125 milligrams, 250 milligrams per teaspoon, and you give them a half teaspoon, they're telling you like you have to account for the patient's weight. So the 2 steps is step 1, you need to convert the patient's weight in pounds to kilograms. And then step 2, calculate how many milliliters you would administer for the dose. So let's do that real quick. So step 1, patient's weight, kilograms. So 68 divided by 2.2 gives me 30.9090. So I'm just going to say 30.9 kilograms. I'm going to multiply by the 2.5 milligrams per kilogram. The kilograms cancel out. So 30.9 times 2.5 gives me 77.25 milligrams. And then you're just going to solve this like you normally do. You're going to use this information here to do to calculate your milliliters. Right, so this is just ordered over available. So 77.25 divided by 35 times 2. You're going to get 4.414. So we're just going to say 4.4 milliliters. And then I worked through this one as well. And you can see that if you watch the review from Tuesday, you'll see that I worked through this as well to get to the 4 milliliter answer. So notice that even when we change the concentration from 2.5 or from 3 to 2.5 and 50 to 35, we're still getting around 4 milliliters to administer to this patient. Okay. Yes. What answer did you get? You said you did it with dimensional analysis. What was your final answer? I just want to know if it's a rounding issue. We got the same answer, so I think you did it right. I got 4.4, you got 4.4. So I think you did it right. Or are you talking about this one here? Okay. So you probably got 4.4 because you didn't round your 73 pounds. So if I did this straight through dimensional analysis and I said 73 divided by 2.2 and then times 3 times 2 divided by 50, yeah, I still get 3.98. So let's see what we got here. Keep trying to get this to bounce down. All right, so if I do this using dimensional analysis, I'm going to advise you just to go ahead and as a separate step, just convert pounds to kilograms, because it'll help to make things simple, or maybe that's what happened. Let me just see here. 2, 3, 2. Oh no, same answer. Okay. All right. So the first thing is converting pounds to kilograms. So I get 33.2 kilograms. And then I'm going to convert kilograms to milligrams with my 3 milligrams per kilogram. Then if I'm just doing this as a straight dimensional analysis, the next thing I'm going to do is look at my 50 and 2. So I'm trying to get rid of milligrams and find out milliliters. So 2 milliliters, 50 milligrams. And then you're going to take 33.2 times 3 times 2, and then divide by 50. Technically, you get 3.984. But you could just round that too. Okay. Oh, okay. You put 33 point, okay. Yeah. Whenever you're doing your pounds to kilograms, round to the nearest tenth. And that seems to be consistent even amongst other like sample tests, sample quizzes and things like that that I've seen with keys. If you're at North Campus, I think sometimes they prefer that you save your rounding to the very, very end, but I think everywhere else just says to go ahead and convert pounds to kilograms and then round from there. So, okay, I have 7 more minutes. Are there any last minute questions we can work through, or are you feeling pretty good? Okay. All right. Well, if you're good, if you don't have any other questions, we can stop here. And if you do have any questions between now and your test next week, just you can send me an email and I'll do my best to answer your question. Just keep in mind that I'm sure like you, except unlike you, I'm not studying for anything over the weekend, but I may not also be on my, checking my email over the weekend. So just give me plenty of time to respond. So don't message me at 10 o'clock Sunday night and your test is Monday morning. I don't think anyway. I think your test is either Tuesday or Wednesday. But if you have it on Monday, just make sure you give me some time to answer your question. Okay. Well, like I said, I'll upload this for your review and then I will clear out my markings and give this to you as a blank and I'll save it as a PDF. Just make sure email me about it, and then B, I will upload it as a PDF probably at the end of the day or tomorrow if I can't get to it today. And if I don't hear from you, good luck on your test next week.
Thank you.
You're welcome.
Thank you.
You're welcome.